Going to be talking about what is breast reduction and who needs it and how is the procedure done. Breast reduction is a procedure where we try and reduce the size of the breast, along with, of course, reducing the skin envelope of the breast, and of course the size reduction is done by excising or removing the gland as well as part of the fat and the skin. Why is breast reduction needed? So that is an often asked question, that should I do it or do I need it? So the breast reduction, the breasts, as you know, come in various different types and shapes and sizes, and there is no one universal criteria to say whether you need a breast reduction or not. The breast reduction is basically more of a process where the patient herself is having issues, because of which you need to do a breast reduction. So if you have back pain, if you're having neck pain, if you're having shoulder pain, if you're having by the end of the day you feel tired because of the weight, because of the dragging sensation that you have, all these are symptoms that most commonly patients come in asking for a breast reduction for. So these are the signs and the needs of the patient, and that is why they finally think that yes, I need to get a breast reduction. Maybe that will improve my pain, it will reduce my pain, and I can do a lot more other things. Some other common issues with patients with larger breasts who are seeking for a reduction is that there is a constant dragging sensation even if they don't have pain. Secondly is, especially in our temperate climates, when you have sweating and there's a lot of especially in summers, you sweat a lot, then the sweat collects underneath the breast, and that causes skin infections, and that can be another major cause for concern. Then of course some other concerns are that they cannot find proper dresses to fit. They don't find dresses that fit breasts because their breasts are out of proportion to the rest of their body. So all these are common indications wherein which the patient asks for a breast reduction and comes in for a breast reduction. As I said before, most commonly it is patient driven. So yes, if you have symptoms, if you're having pain, if your quality of life is being hampered by the weight or by the pain that you're having, then yes, you should go ahead and do it. And so it is not a criteria for me to decide that yes, you have to do it. It has to be more a patient driven and conscious decision, and that is why. So if you're having symptoms and if you're having neck pain, back pain, or you're having infections in the fold underneath the breast, or yes, if it is hampering your day-to-day activities like even going for a walk or exercising or any other thing, then yes, then you're a candidate for a breast reduction. So the often a question asked is, what does a breast reduction entail, or what exactly happens in the breast reduction? So when the size of the breasts increase, they can increase one because of increase in weight, so that the fatty component is increased. Then many patients have PCOS, so that is another PCOD, which is another cause for weight gain. Then of course hormones also play a role, so where the glandular enlargement or the glandular part increases in size. And then of course during pregnancy and childbirth, some patients tend to put on more glands and more weight in the breast area, and that is another major cause for concern. So when you have the fat, you have this, and as the fat, the size is increasing, of course the skin is also stretching, so it's the envelope which is stretching. So you need to reduce the skin, you need to reduce the glands, you need to reduce the fat component. So you need to reduce all three. And but we also preserving your nipples and nipple connection with the rest of the breast, so that you're still able to be able to breastfeed and still able to have normal sensations and function. So the lower part of the breast, so if this is the whole thing as a breast, and the lower 1/3 of the breast as a cone, that is the main area which is usually removed, and then we do a reshaping of the rest of the gland, and then reposition the nipple and the areola into the proper position where it should be, and of course remove the excess skin. So we are basically molding the gland. So nowadays we do this something called the short scar technique, which is basically molding of the gland rather than just the skin. So the effects of the procedures tend to stay longer, and then we remove that excess skin and we remove that excess fat, and then we reshape the whole breast to give you a smaller upright breast instead of a sagging breast, along with the reduction. So what is the healing time? Many patients think that because it's a major procedure and there's a long lot of cutting and stitching that is involved, it's going to take a long time to heal, and I don't have the time. And it's a daycare procedure most of the times, and you can go home the same evening, and you can get back to with our new anesthesia and pain management techniques. You're able to go back the same day. Yeah, and it's quite manageable with oral pain medication, and you can get back to all your normal activities in 3 to 4 days time, and maybe even start going back to work or to all your other activities in by a week maximum, and maybe not doing any impact exercises. So that would take you about 2 to 3 weeks minimum, or it can even go up to about 3 months, where you need the healing to be complete before you can start causing shaking or causing stretching in that area. So that apart from those limitations that you can't do major heavy exercises or heavy lifting, you can get back to all your normal activities within about a week maximum. But most often they get back to their normal routine by about 4 to 5 days. So it's not a long recovery period that you need. Yes, for the scars to settle and mature and everything for the complete healing, yes, it is 3 months, but that doesn't hamper your day-to-day activities, and it is just the normal healing process of the body which the body needs to undergo, and the scars need to mature and settle down. Another question that is asked is, are there different techniques for the breast reduction? Yes, breast reduction has undergone changes since the last 30 years, and there have been newer techniques which have been introduced. But broadly speaking, there are three main techniques that you use. One is doing something called the scarless breast reduction, which is basically a liposuction of the breast, but that removes only the fatty component. It doesn't do anything to the skin, doesn't do anything to the glands. The second most common that is being done now is called the short scar technique. The short scar or the vertical reduction is basically where we try and mold the gland rather than the skin, and then the excess skin is then removed, so the effects of the procedure or the results stay longer. And then the third is the classical approach, which has been done over the years, which is basically an anchor scar, which is basically a circle, vertical limb, and a scar underneath, which is like an anchor. So the anchor scar is the inferior pedicle reduction, we call it, and that relies more on the skin to hold the shape in. So that is why there has been a gradual shift from the anchor scar to the short scar. But yes, it still has its place, and it can be done in certain specific situations. Another important thing which people tend to ask and you need to know is about the scars. So are there scars around the after a breast reduction? Yes, sadly there are scars after breast reduction. So that is one of the major drawbacks of the procedure, if you may call it, because you have to reduce the gland and you have to reduce the skin. So when you're removing that kind of a tissue and that kind of that amount of tissue, then you need to remove some part of the skin as well, and that is what gives you the scars, because the glands are inside, that can be removed, but the skin removal causes the scars. And but as I said, the techniques are improved, because now we are relying on the gland to hold the shape rather than the skin, so the scars don't stretch as much as they used to, and the scars don't become as bad as they used to before, especially in bigger breasts. But you still have scars which cannot be avoided. We try and minimize the scars. At AestheticsPlus, we do the short scar technique, so it's basically one circular scar which is around your nipple, and then there is one vertical scar, so it's called a lollipop scar. So it's basically a lollipop shaped scar, and the circular scar around the nipple, that anyway merges into the surrounding, so it's not seen. It's only one vertical scar which is seen. In some rare instances, if the skin excess is too much, you might need a small T extension on the vertical scar, so that might be there, but it will usually not a whole anchor scar. And the technique difference is basically also in the principle of how it's being done. So even if you have a T scar, it is still not an anchor shaped reduction, because in the short scar reduction we are relying on the gland to keep the shape rather than the skin. Hence the longevity is better, and the scars are also more, they also, because the skin is not being put under tension, the scars also heal much better. Question asked is, can I breastfeed? Yes, breastfeeding is possible even if you are done before you're getting pregnant, and we do it many a times, because the size is causing major issues, so that is why they want to undergo a breast reduction. But we always tend to tell the patients that yes, we have had patients who have been able to breastfeed, we have had patients who are not been able to breastfeed also, and it's just because of the physical aspect of what we are doing. And thinking along those lines, the larger the breast reduction, the more chances you might not be able to breastfeed. As I mentioned before, we are going to be removing only that lower 1/3 of the breast tissue, and then we are going to reshape the gland. But even if 70% of the remaining breast tissue is normal, when we are reshaping the ducts are all twisted, and that could be a reason, most probably, because of which some people are not able to breastfeed. Another important point is doing a breast reduction before getting pregnant, or before or in between two kids. So what happens then? So because during pregnancy and breastfeeding, your breasts are going to engorge, the glands are going to increase in size, the skin is going to stretch, and of course you're going to gain a little bit of fat there as well. So what happens is, everything is again going to stretch and enlarge. So if you can look after the skin properly, and if you can look after the breast properly during that period, then yes, the skin will shrink back to a large extent, and you might not need a second revision. But yes, if the stretch marks are bad and you're not looking after the skin, and there is a lot of increase in the size during pregnancy, and there is a lot of a sag post pregnancy once the glands involute, then yes, you might need a revision. And this is something we tell all our patients beforehand, that yes, there is a possibility, not necessarily, but there is a possibility that if your breasts are going to enlarge too much during the pregnancy, then you might need to have a revision later on, but it might not be towards the same extent as it is being done now for the reduction. These are some of the things, or some of the common queries that people ask for as to what is breast reduction and how it's done. So if you have any other queries that you need to want answered regarding the same, then you please drop in a comment below, and we will definitely get in touch with you to help you answer those.